Very good morning, one and all. I am Dr. Shilpa Srivastava, reader from Department of Oral and Maxillofacial Pathology and Microbiology, Mahatma Gandhi Dental College and Hospital, MGU, MST. So, today's my lecture topic is Odontogenesis. Odonto means teeth and genesis means formation. So, today we are going to discuss about the development of the tooth. The content of this presentation will include introduction and the developmental stages. The developmental stages are bud stage, cap stage, bell stage. Bell stage is further divided into early bell stage and the late bell stage. So, as we all know that the primitive oral cavity is known as stomatium and it is lined by the stratified squamous epithelium. And this oral ectoderm is come in the contact with the endoderm of the foregut to form the buccopharyngeal membrane. On the 27th day of the gestation, this buccopharyngeal membrane get ruptures and the ectoderm of the oral cavity directly come into the contact with the endoderm of the foreguts. So, the underlining ectoderm instruct the overlining endoderm, so that there will be the start of the proliferation. On 6th week, certain area of the basal cell of the oral ectoderm start proliferating more rapidly than its counter adjacent part. It gives rise to the primary epithelial band. This primary epithelial band give rise to the vestibular lamina and the dental lamina. Vestibular lamina give rise to the vestibules and the dental lamina serve as the primordium for the ectodermal portion of the deciduous teeth. Permanent molar arises directly from the distal extension of the dental lamina. Successor of the deciduous teeth develop from the lingual extension of this dental lamina. Now, according to the morphological stages, the enamel organ is divided into the three stages, that is bud stage, cap stage and bell stage. Bell stage is further divided into the early bell stage and advanced bell stage. Now, coming to the very first stage, that is the bud stage. In this, the epithelium of the dental lamina is separated by the ectomesenchyme by the basement membrane, and at the certain point it starts proliferating more rapidly. So, it will give rise to the future position of the deciduous teeth. The main function of the certain epithelial cell of the tooth bud is to form the tooth enamel. Thus, they constitute the enamel organ. Here you can appreciate these are the low columnar cells at the periphery and the polygonal cells at the center of the enamel organ, and this is known as the polygonal cells, and with the peripheral cells we have the low cuboidal cells or the low columnar cells. Cells of the tooth bud and the surrounding mesenchyme undergo mitosis, which lead to the migration of the neural crest cells. The condensed mesenchymal adjacent to the enamel organ is dental papilla, and the condensed ectomesenchyme that surrounds the dental papilla as well as the enamel organ is known as dental sac. Dental papilla. Dental papilla will give rise to the dentine as well as the pulp. Then the dental sac. Here you can appreciate this is the enamel organ, and the ectomesenchyme which is just adjacent to this enamel organ is dental papilla. The ectomesenchyme that surrounds this enamel organ as well as this dental papilla is known as dental sac. This dental sac will give rise to the alveolar bone, cementum and the periodontal ligament. Now, coming to the cap state. It starts from the 11th week. There will be the shallow invagination of the deep surface of the bud. The peripheral cells remains cuboidal, while the concavity appears at the inner surface of the enamel organ. That cells become the tall columnar cells. So, we have the outer enamel epithelium and the inner enamel epithelium. Here you can see this is the outer enamel epithelium and this is the inner enamel epithelium, and this is the concavity. Here we can see the tall columnar cells at the concavity and in the cuboidal cells at the outer enamel epithelium. The outer enamel epithelium is surrounded by the dental sac, whereas the inner enamel epithelium is surrounded by the dental papilla. Dental papilla will give rise to the dentine and the pulp, and dental sac will give rise to the periodontium and the cementum and the alveolar bone. Now, here you can also appreciate another layer, that is the stellate reticulum cells. These are the polygonal cells and these are the star shaped cells. So, the polygonal cells that lies between the outer enamel epithelium and the inner enamel epithelium is known as the stellate reticulum cells, and the water from the outer covering, means from the dental papilla, it goes inside these cells and it will start proliferating because of the presence of the glycose aminoglycan. So, it acts as a shock absorber, support and protect the delicate budding enamel organ. Now, coming to the early belly stage. As the stages advances, the invagination become deeper in the enamel organ. The crown shape is determined by the pressure exerted by growing dental papilla cells on the inner enamel epithelium, which is equally opposed by the pressure present on the stellate reticulum cells. Now, the cell differentiate starts at the cuspal tip and last at the cervix. In this stage, we see the inner enamel epithelium, outer enamel epithelium, stellate reticulum as well as the stratum intermedium cell layer. So, here we can see this is the deeper invagination of the ectomesenchyme. This is the inner enamel epithelium. Just above this, 2 to 3 layer of the stratum intermedium. This is the stratum reticulum, and then we have this outer enamel epithelium. Here you can see the capillary loops in between this. So, there will be the reversal of the nutrition. Now, the ingrowing ameloblast from the inner enamel epithelium will get its nutrition from these capillary loops. The inner enamel epithelium consists of the single cell layer, which is known as ameloblastoma. This ameloblast gives rise to the enamel, whereas the inner enamel epithelium exerts an organizing influence on the underlying mesenchyme cell in the dental papilla, which will differentiate into odontoblast, and the odontoblast will give rise to the dentine. The another layer, that is the stratum intermedium, it lies between the stellate reticulum and the inner enamel epithelium. It contains the well-developed cytoplasm organelle, acid mucopolysaccharide and glycogen. It helps in protecting the newly developed enamel. Stellate reticulum. This cell expands further, but just before the formation of the enamel, this collapses. So, the distance between the outer enamel epithelium and the ameloblast reduced. The outer enamel epithelium, the cells of the outer enamel epithelium are flattened and low cuboidal. At the end of the stage, it leads in the fold, and between the fold there will be the adjacent ectomesenchyme, which will help in the reciprocal induction or reciprocal nutrition to the budding enamel organ. This provides rich nutrition supply for the intense metabolic activity. Now, coming to the last stage, that is the advanced belly stage. It begins at the age of the 18th week. It is characterized by the mineralization. So, there will be the deposition of the dentine followed by the deposition of the enamel in this stage. The formation of the dentine occurs first as the layer along with the future dentino-enamel junction in the region of the future cusp and proceed pulpally and apically. Here we can see this is the odontoblast. So, this ameloblast which laid the formation of the, which give the influence to the odontoblast, and with the influence of the amyloblast, this odontoblast leads to the formation of the dentine. So there will be the deposition of the dentine. Then after the deposition of the dentine, this predentine will have the reciprocal induction to the amyloblast, which leads to the formation of the enamel. So this is how the enamel and the dentine forms in the advanced Bailey stage. The enamel formation proceeds outward and cervically. After the first layer of the dentine is formed, the amyloblast will lay down the enamel over the dentine in the future dentino-enamel junction. So in this lecture we have covered all the three morphological stages, that is the bud stage, cap stage, Bailey stage. In the Bailey stage we have covered the early Bailey stage as well as the advanced Bailey stage. Thank you.